So in this short video, I'm going to talk to you about substance misuse, and at the end I'm going to set you some talking points for discussion boards. Rather than doing a face-to-face tutorial on this, we're going to do it in a slightly different way, and I can talk about more at the end about that. So we want to think about what substance misuse is, what we mean by those terms, and how it would affect us as a dental care professional. So the definition, I mean, you'll find many definitions, but what I've got here from the Mental Health Association UK is the definition as the continued misuse of any mind-altering substance that severely affects a person's physical and mental health, social situation, and/or responsibilities. So we're talking about a use of a substance which may, for some people, be absolutely fine to use, but for others can be a problem. And then there's some substances that any use we would consider to be a misuse because they always have these effects on people. So alcohol and tobacco are ones that you've spoken about already, and sometimes we can think about them differently to other drugs and other drugs that we're going to talk about today, because we can think that they don't severely affect ourselves, but in reality, there is always the potential for that. So tobacco, any use of tobacco is considerably affecting your physical health and also your mental health. If you are addicted to nicotine and you're not able to access it for whatever reason, that can have real profound effects on your life, your ability to act in social situations and things like that. Alcohol is safe to use to an acceptable level, as we've discussed quite recently in Clinical Practice 1, but when it's taken beyond that, it can really affect people's whole lives. So we're not just talking about your illegal drugs and your prescription medicines, we're also talking about things that are available legally and people are misusing them to an unsafe level. There's also a term that you hear when you look at substance misuse, and it's called new psychoactive substances. And these are substances which have not yet been defined or sometimes even discovered by the medical or legal profession. But there's still drugs that people are abusing that are causing these effects that are listed in the definition there. So there's lots of things basically that would come under the term of substance misuse, and it's important to keep that broad mind when you're thinking about the various different drugs that are available to be misused. So in Scotland, we do have a particular issue with substance misuse. So there were 867 drug-related deaths in Scotland in 2016. And that was twice as many as 10 years previous to that. That's quite a shocking statistic. Also, we are in Scotland 2.5 times the rate of drug-related deaths than the rest of the UK. And when we talk about drug-related deaths, there is, the obvious with a direct effect, an overdose or something like that. But we're also talking about conditions that people end up in because of their use of drugs. So homeless, for example, suffering with things like pneumonia and general health problems, all related comes down to the fact that they are a drug user. When we talk about drug-related deaths, we're talking specifically or almost entirely about opiates or opioids, and we'll talk a wee minute about what we mean by that. But they were related to 88% of the drug-related deaths in Scotland in 2016. Alcohol is recorded separately from drugs. So in 2016, there were 1,265 alcohol-related deaths in Scotland. So significantly more than drug-related deaths. And that is also increasing. That's a 10% increase on the year before. So overall in Scotland, we don't have a particularly good record with substance misuse, and therefore it's even more relevant to us and what we do to try and enable people to move on from this situation. It also makes it not uncommon that you're going to come across this in your emerging new careers. If you want to look at more information about substance misuse, obviously I'm only talking about deaths here, there's lots of other data about how drug and alcohol affects people's lives. The National Records of Scotland, so their website's down there, have all that kind of information. So let's go through the different substances then that people can misuse. I'm not going to go into them all. I'm just going to talk about the most common ones and the things you most might likely come up against. So alcohol is absolutely the most commonly used mind-altering drug in the UK. It's not necessarily abused by everybody or misused by everybody, but an awful lot of the adult population will use alcohol at some point in their lives. And it is always a mind-altering substance. You may only have 2 or 3 glasses of wine, but it does change your perception of things. You may not be drunk as such, but you will feel differently. So it is a mind-altering drug, and it can absolutely be misused. There are some direct dental effects. So specifically, patients who you misuse alcohol, so have alcohol above the maximum recommended amount of 14 units per week. They have direct dental effects. So, for example, you see erosion. That's either from the acid from the alcohol itself or because they're suffering from reflux or vomiting. So, intrinsic or extrinsic acids are coming into play here. There's also a higher risk of facial trauma when patients have been misusing alcohol. They're very drunk, they're behaving in a way not what you would expect from somebody. They're more likely to get into fights. They're also more likely to fall over and damage their face and therefore have an injury from that. And they're also at a much higher risk of oral cancer. So very specific dental effects. However, there are also social effects that are relevant to us. We need to think about things like what a person's home life is like. Are they themselves at risk? Are they putting other people at risk? Maybe their partners or children that they live with if they are regularly misusing alcohol. Financially, they're likely to be having difficulties if somebody is drinking heavily on a regular basis or perhaps struggling to hold down a job, and therefore their finances could be affected, which could directly affect the treatment that we're able to provide. And there's a number of other social effects that have been spoken about before, so I don't want to spend a long time on this. But the gist of what I'm getting at here is that alcohol is absolutely misused, and not irregularly, and not always by the people that you might think. In terms of what we do for alcohol on patients who are misusing alcohol, we have our fast screening tool and our alcohol brief intervention process that we can follow to help signpost people in the direction. And that's really true of all substance misuse. With the exception of tobacco, it's not necessarily our place as dental care professionals to be providing people with a lot of advice about the cessation of their habits. But it is very much our role to identify if somebody has a problem and signpost them in the direction of the people who can help them. So thinking then about tobacco, like I said earlier, it is a mind-altering substance and it does have physical and social effects on the users. The Scottish Health Survey 2016 found that 1 in 5 adults were current smokers. So that's 21% of the adult population. So that is a lot. And it is higher than the rest of the UK and Europe as a whole. It's not necessarily increasing though, unlike drug use. It's about similar to the previous year. There is 100% an association with oral cancer, as we know, and the combined use of alcohol and tobacco increases your cancer risk by over 35 times. So significantly increased. Tobacco reduces our healing capacity of our mouth because it reduces the blood supply, and therefore there's a much higher incidence of periodontitis in smokers. Smokers are more likely to lose their teeth at a younger age because of their periodontitis. So it's a very clear dental effect. And also, people who smoke, again, due to reduced healing capacity, can suffer from things like a dry socket, which is a very painful infection after a dental extraction. It's a big part of our role as a GCP to give smoking cessation advice, hence why we've emphasised it a lot to you. By failing to advise somebody on the risks that they're putting themselves at by smoking, we're very much failing to provide patients with an appropriate standard of care. So if we move then on to illegal or illicit drugs, these are the things that we most commonly think of when we think of substance misuse. There's a lot of work done to give us statistics about illegal drug use. I've listed some there, but there's a number of surveys done. What we can see from that is, in order, the most commonly misused illegal drugs are cannabis, as by far the most common, and always has been for a long, long time. Cocaine, and then there's MDMA or ecstasy. And then you do have other drugs that are misused, obviously things like heroin. And heroin we tend to think of as like the most common issue with drug misuse, but it's really not. It's there, and we're going to talk about it. But of all the illegal drugs that are available, it's by far not the most common one. There has been an overall decline in drug use over the last 10 years. However, as we just looked at there have been an increase in drug-related deaths. So whilst fewer people are using the drugs, they are being used to a more dangerous extent. These new psychoactive substances that are being developed we don't understand them at all. We can't treat people who present with overdose and other side effects because we don't know what it is that people are using. So all in all, there is an increase in deaths, but per head of population, there is a decrease in drug use. So we're going to look at just a few of those drugs that we've mentioned already. Cannabis, like I said, by far the most common drugs that people will present to you with. People are often quite open about their cannabis use. It's a lifestyle that some people have adopted. And some people feel that they manage their lives perfectly well whilst using cannabis. It is, however, still a substance which is being misused because of the mind-altering effects it has. People can use it in various ways. Most commonly, it's smoked, often along with a tobacco-based product. So all the risks that are associated with smoking are often also there if you're using cannabis, as well as other issues on top of that. It can also be eaten or ingested as a drug. It has quite clear sedative effects on people. People feel more relaxed. Everything just happens a bit slower. It's an issue if people are trying to do a normal day-to-day job or drive or things like this, if they've got a responsibility for anything, because it just makes you a lot slower in terms of your actions. And whilst under the influence, people often appear to have this glazed look in their eyes. Sometimes they find things funny that in an inappropriate circumstance, things like that. Cannabis is often referred to as a gateway drug, in that it's a drug that people may use initially. People often use it when they're young, and then they progress on to use other drugs. And whilst some cannabis users feel that they're not addicted and they don't ever progress to use other drugs, that doesn't mean that it isn't a gateway drug. It absolutely is. All the statistics show us that people who use cannabis often go on to use other drugs. Not everybody, but it is common. And there are definite long-term health effects of using cannabis. Obviously, if you're smoking it, you're going to have the same risks as you did with tobacco. You're going to have an increased risk of lung cancer and other respiratory disorders as a result. There's also mental health problems associated with long-term cannabis use, increased incidence of depression and anxiety, and potentially other mental health problems such as schizophrenia. So it's not a benign drug. There are issues associated with cannabis use of any level, hence why it's a substance we would class as being misused. Cocaine is a drug which its use has increased in recent years. Cocaine used to be considered an expensive or a posh drug, and it's really not the case anymore. It's commonly used in a younger younger bracket, and also more commonly these days used recreationally rather than on a daily basis. However, the problem with cocaine is that it is a powerfully addictive stimulant. It really hooks people in, and whilst people may feel like, oh, they only use it at the weekends, long-term use always increases in its frequency. It's most commonly found as a white powder that's snorted. However, it can be found in a lot of different forms. For example, crack cocaine is cocaine that has been modified and is either smoked or injected. So it comes in lots of different forms. It's a very powerful vasoconstrictor drug. So when people use this drug in that area where it has been taken into the body, you have a real lack of blood supply to the area, and for quite a prolonged period of time. Because of this, it's not uncommon in regular users to see tissue necrosis, and that can happen in various different places. If somebody snorts the drug, you can see tissue death in the nose. You can also see through the palate as well. If you have a wee look on the internet, you'll find pictures of people with a great big hole in their hard palate, and that's because of the cocaine use as snorting it through their nose has gradually worn away the tissue in the nasal cavity, and we now have a common oral and nasal space. It can also be used like rubbed on the surface of gums, and you will also see tissue necrosis in those areas. Whilst it's a stimulant drug, so it gives people a euphoria, a high at the time, you're often left with, as the drug wears off, twitches and tremors, so uncontrolled muscle movements. And we also need to think about, if we have a patient who's a regular cocaine user, our local anaesthetic is derived from a similar source. You might be aware of the drugs lidocaine and articaine. These are drugs that we legally use, prescription drugs that we use for anaesthetic. You'll notice that they also end in "ane", just like cocaine. And that's because they're derived from the same substance. So if we have a patient who's regularly using cocaine anyway, and then we want to inject them with more substance that's derived from the same source, we need to think about, is that safe or not? MDMA is a drug that you're probably more commonly hear called ecstasy. It's an amphetamine, and there's a big group of amphetamines. They're synthetic drugs. So whereas cocaine and cannabis were coming originally from a natural source, MDMA has been developed in a lab to produce very specific results. Real, what people would call an upper. Lots of energy, really pleasurable feeling. I say emotional warmth, that people often want to hug you, tell you they love you, that kind of thing. And real distorted sense of reality. The world, it looks different. Time passes differently. The way people behave appears differently. Everything looks and sounds different. So a real stimulant drug. MDMA does tend to be used recreationally. It is still misused regardless of how often you use it. It tends not to be a drug that people are using on a daily basis because all those things that I've just said there are not particularly compatible with day-to-day life. In terms of a dental side effect of it, because of the increased energy, increased muscle activity, people often do what you might be known as bruxism. So they clench and they grind their teeth, and they do it a lot. So that can result in what we'll call attrition, so wearing down of the teeth because of tooth-on-tooth action. There are also issues with anxiety, paranoia, and also memory loss, and that can go on for quite a long time after use, and it will depend from person to person. But patients may be coming to see you on a Wednesday or a Thursday who've used MDMA at the weekend, and they could still be having issues associated with it. So those three that we mentioned there, cocaine, cannabis and MDMA, are the three most commonly misused substances in the UK. But I do want to talk to you about heroin because whilst it's not particularly common, it's a drug that so hugely impacts on people's lives if they're users. So it is a highly addictive opioid drug. It originates from the same origin as morphine, which is an opioid painkiller, the strongest painkiller that can be prescribed by a medical professional. It's synthesized from the opium poppy, and it has been opiates as a whole have been a group of substances that have been misused for a long, long time, hundreds and hundreds of years since that poppy was ever found. Generally found in a white or a brown powder, and it can be used in a number of different ways. We think sometimes as heroin as just being that drug that's injected by people on the streets, but it's a much wider problem than that. Drug users of heroin report this initial euphoria, this feeling of immortality, that they're untouchable, everything feels amazing, followed by really prolonged periods of drowsiness. So for a long time after somebody's used this, they have this sort of spaced out type phase. Heroin addiction is a really terrible chronic disease characterized by relapsing. So I think it's important to understand that nobody chooses to end up in this situation. People don't think one day, oh, let's be a heroin addict. People end up in that circumstance and then they are stuck in this real awful situation. It is such a powerful addiction that people will do anything, regardless of the consequences, in order to access that drug, because life without that drug for them is not worth living. The side effects of coming off a drug like heroin, the withdrawal effects are profound, physical and mental anguish. Really, really unpleasant. And whilst people may really, really want to come off that drug, it's incredibly hard for them. There is a rehabilitation program available for heroin, and we use a drug called methadone, which is prescribed. It's effectively medical grade heroin. It's the same drug, but it's produced by the medical profession to try and allow it to be controlled a bit better. The problem with heroin and any drugs bought illegally is that you're never 100% sure what's in them. They can be mixed with a whole manner of dangerous substances. So methadone is designed to give the user the same feeling, but without the risks associated with anything else that could be mixed in with the drug. And the idea of a methadone rehabilitation program is that should be gradually phasing them down to the point where they can manage their withdrawal symptoms slowly over a prolonged period of time. However, unfortunately, methadone itself is also a substance which is misused and can be sold on illegally, despite a lot of restrictions in its use. Methadone also, unfortunately, is given to patients in the form of a thick, sickly syrup liquid, really, really high sugar content. And that's for a couple of reasons. Firstly, because it helps mask the taste of the drug itself. But also it's to do with trying to reduce the misuse of methadone. So sugar-free methadone is available. However, there's a problem is that if sugar-free methadone can be injected, and therefore it's more likely to be misused. Whereas sugar methadone physically can't. Whilst you might be able to heat it up and thin it out, as soon as you inject it into the body, it will solidify again. So it can't be misused in the same way as sugar-free methadone can be misused, whereas sugary can't in the same way. And therefore, sugar-free methadone is really prescribed. Patients are having this on a multiple times a day basis. They've often got quite an erratic lifestyle, and therefore patients who are on methadone have a huge increase in their caries risk. So methadone is a particular issue from us from a dental perspective. However, it is, of course, there to try and improve the patient's long-term outcome in terms of their overall health. So then, regardless of what we're talking about, somebody who is a substance misuser, there's certain number of things we can say about them. Sometimes we might exclude patients who are tobacco users from some of these categories, but some will apply to them. But everything else, including alcohol misuse, would you can think about these considerations. So patients who misuse drugs are more likely to experience anxiety in day-to-day life. And that also applies to dental situations. So you often find people who are drug users and alcohol users to have real fear, phobia associated with dental appointments. They may lack understanding of what you're trying to say. They may not understand or have the attention span to be able to listen to your explanation of what's wrong with them and what treatment you want to provide. And that has a clear issue with consent. How can somebody consent if they can't understand what you're trying to tell them? And how do you know if they are understanding what you're trying to tell them as well? It's a very difficult one in terms of consent. These patients have erratic lifestyles by the nature of the fact that they're misusing a substance. So their attendance rates are poor. With all the best will in the world, they may try to come to their appointments, but other things get in the way. And their lifestyle habits in general contribute to their poor dental health. They have poor diets. They don't have a regular sleep-wake pattern and therefore don't have a regular brushing pattern. So all these things compound the fact that the drug itself is also causing them direct dental effects. They may well have difficulty accessing dental care physically. They may not live in a set place. They may be migrant and therefore have issues with regular dental care. And they are often victims of discrimination. They feel like, or they're made to feel like, less important members of society, which makes them not want to come and see us. They feel like we're going to judge them because of the situation that they've found themselves in. So all these things together can have some quite serious impacts on our management of patients who are substance misusers. So when you're treating patients who are substance misusers, there's a few things you always want to have in your mind. Everybody has the right to be treated with dignity and respect, regardless of their circumstances. It is not acceptable for us to pass judgment or change our treatment of a patient simply because they are a substance misuser. They still have the right to everything that everybody else would have. There is a difference between equality and equity. So equality means that everybody's treated the same, whereas equity means that everybody has the same availability of the best possible options for them. So it may be that some treatment options are not appropriate for drug users. That's okay, as long as you're still giving them the best options for them to have the best outcome. And that's the most important thing. Don't presume that you can spot a drug user or anybody who's misusing any kind of substance. Drug users are not all junkies like from train spotting. There's a lot of functioning substance misusers. When we talked about alcohol in terms of your fast screening, we talked about how some people can drink regularly above the weekly maximum amount, but still seem to have perfectly normal functioning lives and high-powered jobs. And the same is the case for people who are substance misusers, particularly things like cocaine and cannabis. These are drugs that people can use on a daily basis and you wouldn't know. So don't presume that you can spot a substance misuser. You really can't. Patients are under no obligation to tell us. If a patient discloses these things to you, then we need to treat that with the respect that that disclosure deserves. But they don't have to tell you these things. That's entirely their right. We used to say that people who were particularly intravenous drug users were a higher risk of bloodborne virus, and therefore we would manage them differently. We would do things like treat them at the end of the day so that you could clean down, do an extra deep clean of the surgery. We might not use things that created aerosol like high speed or an ultrasonic scaler. That is absolutely not the case anymore. Yes, a patient who's an IV drug user may be at a higher risk of a bloodborne virus. However, it is completely irrelevant to us. We have universal infection control measures, and as long as we are adhering to that infection control policy, there is no issue with transmission of bloodborne viruses. So they can be seen at any time of the day and have any treatment that's appropriate to them. The last thing I've put on there is always have a chaperone. Now, we as a school would suggest that should always be the case anyway. You should never be treating a patient without a nurse, effectively, is what I'm saying here, because anything that can happen with any patient. However, in particular with people who are substance misusers, the behaviour can be erratic and unpredictable and at times inappropriate. For your own safety, both physically and in terms of your registration as a dental care professional, you should always have somebody there with you, just in case. If we think about specific dental aspects then of treating patients who are substance misusers, they have an increased risk of all the diseases that we would treat. Increased caries risk because of this erratic lifestyle that they have. Most substances which are misused induce carbohydrate cravings, might also be known as munchies. People want to eat and they want to eat junk, and that is often a high sugar substance or liquid. And some substances that are misused may have a high sugar content themselves. We already mentioned methadone, but also some alcohol, depending on what the person prefers to drink. So much higher sugar intake. People also experience xerostomia, so a dry mouth, particularly with opioid-based drugs, but also with alcohol because it dehydrates you. If you have a dry mouth, you have a reduced buffering capacity of your saliva and therefore an increased caries risk. So you see a lot more caries in patients who are substance misusers. They have an increased periodontal risk, either directly, like we said, with smoking and alcohol because of a reduced blood supply to the area, but also just generally due to poor nutrition and this erratic lifestyle again. Their immune response is altered and therefore they're at greater risk. Oral cancer we've touched on a number of times here. Smoking and alcohol are your big issues there, and the increased caries risk, cancer risk, sorry. And there's a few other things I've put on there to consider. There's an increase of mucosal trauma, and what I mean by that is biting, so cheek biting, lip biting, that type of thing, common in patients who are using drugs that cause that grinding and clenching that I mentioned. Smoker's keratosis is specific to anybody who's inhaling drugs through the smoking process, so tobacco, cannabis, heroin, cocaine, various different options. And what you see is hyperkeratosis of the tissues, so tissues that are already keratinized become more keratinized, or non-keratinized tissues become keratinized, and you see a white appearance to the tissues. It's a precancerous state, and therefore we need to keep an eye on that. And then the other thing you see commonly in substance misuse is fungal infections. Thrush, oral thrush, denture stomatitis if they wear a denture, and angulus colitis, so a little fungal infection at the corner of the mouth. And this is all because they're not well people in general. Healthy people don't suffer from fungal infections because we have a good balance of bacteria and fungus in our body and it sorts itself out. However, if you're unhealthy, then the fungus can overcome your body's natural defences, and then it presents in this way. So that's also something you see commonly. And glossitis is an inflammation of the tongue. The tongue gets swollen, red, very fissured, and dry. And again, it's all just to do with poor general health and poor nutrition. We describe the mouth as like the window to the body. You can see a lot of things in the mouth that are reflecting general health. And people who are substance misusers don't have good general health by the nature of what they're doing. So how does this all relate to us as dental care professionals here? Surely what I've just talked about there is stuff for doctors and healthcare workers who are dealing with this on a regular basis. You will see substance misusers on a regular basis, whether you know about it or not. So it is something we need to be aware of, both in terms of how it affects their mouth, how we manage a patient who's in that situation, and also how we can help improve their life in general. So I've set a couple of discussion board questions for you, which I want you to go and have a look at. The first is this one here. So a patient attends your clinic with real distinct pain due to an acute periodontal condition. So their gums are red, they are swollen, bleeding. We're talking about a condition called necrotizing ulcerative gingivitis here. I don't necessarily expect you to know what that condition is at the moment, but trust me when I say it's very uncomfortable for the patient. They're very open with you and tell you that they're a heroin user on a daily basis, and they have used that morning because that's how they get through day-to-day life. So what you're faced with here is a patient who is in pain. They've got a dental problem. However, they are under the influence of a mind-altering substance. So I'd like you to have a think about how you would manage that. You can go and do some reading if you want and have a discussion on the discussion board about it. You may find that you're coming up with different suggestions, and that's okay. I will intervene at some point in the discussion board and give you a sort of definitive answer, but I'd like you to have a think about it. You may have experience from previous working, if you've worked as a dental nurse or in healthcare as a whole, or potentially in any other aspects of employment. So have a think about these things and have a talk about it. The other thing I want to think about, or you to think about, and this is the second part of the discussion board task, is the GDC standards for the dental team. And if you go onto the GDC website that I've linked to on the discussion board, you can get an even more detailed breakdown of these standards there. And I'm talking about specifically 1.3, 1.7 and 9.2. These are standards for the dental team for how we behave. So I'd like you to have a think about how these standards relate to this topic of substance misuse. And again, you can have a talk about that on the discussion board. So that's the end of this session here. Like I say, I will contribute to the discussion board as well so that we can come to some definitive answers. But it isn't quite a clear-cut subject as perhaps we've talked about previously in the biomedical sciences module. There's less right and wrongs. There are some definite no's and some definite yeses, but there are some grey areas which we can talk about on the discussion.